evening. Thank you so much for tuning in. I'm Amitha Balachandra. Today, I'm going to particularly focus on Bangalore because a number of cases have been rising over the last couple of days. There are also reports talking about how people are struggling to find beds in the city. In fact, we've been getting a lot of SMS messages from people in Bangalore talking about oxygen beds and lack of ventilators also. Additionally, there are reports of crematoriums having long queues and that mass cremations are in fact taking place. Amidst all this, where does Bangalore stand? What's going to happen over the next 2 weeks? Because right now we know that the Chief Minister has ordered a close down and there are restrictions, fresh restrictions in the city where essentials are only open between 6 and 10 a.m. In the morning every day. We also know that there is a weekend curfew, but is this the solution? What should we be looking at? What should the government be doing at this point? And should citizens be further worried? Will this crisis even get worse? Those are the questions we're going to be asking to Dr. Vishal Rao, who is the Dean and Center of Academics and Research Healthcare Global Cancer Center. He's also a member of the State COVID Task Force. So I'm very glad that he's taken out 10 minutes of his time to speak to us at a time like this. Thank you for taking 10 minutes time out of your schedule. First of all, if you can tell us, how much worse is it going to get? What's the situation when it comes to oxygen beds, ventilator, and hospital beds at this point? Because there are reports talking about how the city is running out of beds.
Thank you, Amita. See, I would like to give some context to this discussion. The most important premise that we need to highlight here is this is a socio-economic virus. And wherever there is going to be a hub of socio-economic activities, this virus is going to explode. This is something that we very well knew. And naturally, we knew through the Technical Advisory Committee's directions that this wave was imminent and it was around the corner. Now, at this juncture, naturally, we are at a point in time when it is at a literal point of explosion of the number of cases. Now, somewhere I largely believe at this juncture that we left our guards down. And I say this because I have been categorically requesting the citizens in every media discussions, in every forum to tell that every socio-economic zone, whether it is a house, an apartment, or whether it is your workplace or your shop, you will need to run it like an OPD. You will need to run it like a hospital, wherein you take so much of precautions, you wear your scrubs, you wear your gloves, you wear your mask, you wear a face shield, and take care of yourself and still be productive. That's going to be the key to keep yourself negative. And that is what we doctors did. Now it's been a year and a half. It's been a year and we're still running on and we are maintaining and protecting ourselves. And that is the precaution a citizen would need to take and not be lackadaisical, not let his guards down. At this juncture, I feel the governments have a role to play. But what is that role? It is going to be awareness. It is going to be enforcement. What awareness can they do? They can create awareness among the citizens to say, please don't lower your guard, and they can enforce the same. Today, Bangalore is at a state of lockdown. Now, lockdown in general, we need to understand is not the treatment for the COVID virus. It is a way by which you can prepare. It is a way by which you can create a China wall between the positive and the negative. And during this period, you prepare beds, oxygen, testing, and other things. Now, this is a desperate measure that has been taken by the state government in order to bring discipline to the people, to tell them, look, if you're going to keep lowering your guards and if you're going to keep running the show like this, the second, third wave, fourth wave is imminent. It is going to come. And that's the important message that we need to decipher out of this to say, look, at this juncture, we cannot tell that, look, we lowered our guards, we got infected. Why is the government not doing anything? Yes, the government is going to do whatever it is having in its capability to prepare. And that is what they have done.
So you're saying that citizens let their guard down very clearly. But if you can talk about what the government is doing at this point, because there are reports, and I'm quoting one Indian Express report, which very categorically says that the number of ICU ventilator beds available for patients in government hospitals in the city went up by only 18 beds between the first and second wave, despite nearly 2,025 ventilators being supplied to the Karnataka government by the center last year. So do you believe that the government took it lightly as well? Because there was a lull period before the second wave.
And that's another aspect of it. So I spoke about the citizen aspect of it. Now naturally there is a lot more that we could have been prepared with. We had an assumption, and this is something that I categorically wrote in many op-eds, that during the beginning of this last year, at the same time we spoke saying that India is different from UK and we are different from US. Our immune system is very strong and special. We also spoke that Karnataka is different from Kerala, which is different from Maharashtra and Delhi. We are unique. We all knew at the end of it that it was not true. Now, at this juncture, we assumed in some strange way that maybe this is not going to go bad. We assume that we somewhere have overcome this virus. We assume that we have conquered the first wave and we are not going to have the second wave. And in that particular thing, I would say all of us let the guards down. Whether it's the government, whether it's the citizens, have left the guards down. And that is what has led to this current catastrophic moments for us, where we are seeing people dying at homes, we are seeing people dying in the hospitals, we are seeing people gasping for breath, and there is shortage of oxygen or ICU beds. At this juncture, there are two crisis situations that we are looking at. One is in terms of beds, whether it is ICU or whether it is this. And in addition to that, the manpower. Now, let's say that if you look at September, there were 800 odd patients in the ICU. Today, we have more than 1,500. At this juncture, we see that there is a difference between the mortality that is happening in the population versus mortality or deaths that is happening in the hospitals. It's way far larger. And the most important thing here is manpower. Please look at manpower. What is this manpower? There are four categories here: doctors, nurses, housekeeping staff, administration. Where are these people? These people are burnt out. This last pandemic of 1 year, we've all been burnt out. We've been away from families. We've been psychologically dejected, frustrated. And now, just at the time when we are thinking that we are going to resume some amount of sanity, we are getting ready for the second one. Today, every day, when we sit into the ICUs, we talk to our pulmonologists, ICU heads, when we talk to our duty doctors, it's futile, frustrating. And naturally, at this juncture, we are reached a point when we are at the brink of an uncertain future, and that's what's worrying everybody at this point in time. So naturally, yes, we are having shortage, and hopefully this particular lockdown is going to give us some more time to prepare. But this lockdown cannot be another way by which we plan an unplanned lockdown.
That let's talk about the crisis. And before I move on to what's going to happen next and what advice is being given to the government as well, if you can tell us, you said that there is shortage of oxygen and beds in the city. What is the percentage? You also spoke about a shortage of manpower at this point. Where is Bengaluru headed? Will we see a peak maybe in the next couple of weeks, or has it already hit its peak right now?
So, lot of learning lessons from other states. What we know currently is, like, there are states like Maharashtra that is saying that they are seeing some lowered numbers. We again cannot lose our guards, assuming that it's going to just disappear in 1 month. But we assume that this peak is going to hit in the next coming weeks. Now, why we say this? Let's say last year we had the data which we had from 1918, 100 years back. This year we have the data from last year. So let's make a safe assumption to say last year what was the data like? Last year during this period, the jump happened between the base of the curve to the peak of the curve in 3 months. This year, this same assumption, if you make, and if you double the population, if you look at the way the socio-economic zones have opened up, this is naturally going to go wider. And how much wider is currently being decided by the virus, which is being moved by us. We are the ones moving the virus. The virus doesn't have hands and legs to move. We are the ones moving the virus. So how much are we going to move is going to decide how far this virus is going to spread itself. And at this juncture, the only thing we assume from previous data, which our experts from the epidemiologists, virologists are talking about, is let's get ready for the third wave, because the second wave is going to rise and we may not be able to do much. But if we are able to ramp up our vaccination, we may be able to get some kind of protection against the third wave at least.
I also want to talk about testing. There's massive delay in the number of tests. First of all, the number of tests being conducted and the results to come in as well. I hear again from a lot of people in Bengaluru that Home testing in several areas are not even being conducted. They're having to go to centers. So with that kind of problem, how is this going to go ahead, you think?
In fact, I agree with this fully. Today, I have dealt with patients who are COVID positive, who are well educated, affordable, who told me that we got mild symptoms. We waited for 1 or 2 days, hoping that with medications it will subside. Did not go for COVID test because we were apprehensive. Educated people. By the time the fever set in, and we thought, okay, in a day or two, let's decide. And by that time, the fever worsened and breathlessness started. We ran in for our test. And at that juncture, when we went and ran in for our tests, by that time he was gasping for breath and we couldn't get a bed. Now, this is the story of several people who are panicking. Now, there are two lessons to be learned here. The moment you get a symptom, get yourself tested. Don't let it come to the stage of breathlessness. And that's the gap you need to correct, because on an average, in an overburdened laboratory system today, when people are already overburdened with testing, it is going to take a minimum turnaround time of 48 hours. So at this juncture, if you're already at the verge of breathlessness, you are going to get worsened, because no hospital is going to admit you unless there is a COVID test. So it's very important right now that there is shortage of bed. There is already shortage of ICUs. Over and above that, if you do not have a test report, it worsens the whole scenario. So I think the people and the citizens also would need to know that the moment you have the slightest suspicion of symptom, please get yourself tested. Do not ignore it at any cost.
And if you can also tell us, if we put this report up on the screen as well, there is an investigation that the News Minute conducted where they're talking about underreporting of figures, especially COVID deaths. Are there far higher deaths than what's being reported in the city?
Personally, this has been a concern that everybody has been talking about. And you see the today's frontline headlines of the Times of India is reading underreporting. We've got Financial Times talking about underreporting. Everybody's talking about underreporting. So definitely there seems to be a gap. Now, is this because of what the numbers are relating to? We are not able to decipher, but obviously we see that there is seeming to be a gap in the number of people dying versus the number being reported. Now, could this be because there could be a difference between the population-based registry that is being referred to versus the hospital-based registry and death certificate? Is something that we need to look into. And already there is a team that is investigating into it to understand where is this gap arising from. And I think that needs to be addressed for all the citizens to know.
Also, Dr. Rao, if I can also ask you this question, do you believe that the lockdown perhaps should have come a little earlier? First of all, two things I want to know from you. One, do you think that the restrictions are good enough? Whether it should have come earlier? And second, do you think that it should have been far stricter? Because, for instance, marriages are still allowed with COVID appropriate behavior and 50 people. That itself is also going to be a problem.
I want to tell and re-emphasize, Amita, again, this is a socio-economic virus. Lockdown for this particular thing is not the treatment. The people need to understand this, that in a socio-economic virus, the more social activity, the more economic activity, the more this is going to explode. Naturally, we are at an economic meltdown at this juncture in India. At this juncture, we need to curb social activities top priority. Whether it is a marriage, whether it is a funeral, whether it is a gathering, whether it is any kind of gathering, we need to stop immediately. The second step, economic activity. You need to run your economic zone like a hospital. That's all. If you want to survive this particular COVID pandemic, second wave, third wave, fourth wave, run your economic zone like an OPD or like a hospital, and stop social activities as much as possible. And even if there are some social activities connected with economic activities, you need to curb it with utmost precautions, understanding four important rules: masks, well ventilated indoors or preferably outdoors, social distancing, and hand hygiene. This is the only four mantras that we doctors are doing currently and running our duty. We are seeing our patients, we are running our OPD. Now, currently in this single room of mine, I've ventilated the full room. I've just removed my mask because the entire room is locked and I'm just breathing and with all ventilations. But at the end of it, it is very important to understand that round the clock, this is my first vaccine. This has been my first vaccine. The second is I've already taken the second vaccine, 2 doses of it. And after that, I'm able to serve people. This is the most important thing. You cannot be lackadaisical about this. I have seen educated people, uneducated people, and the enlightened ones all misbehave.
What advice do you have to people who don't have symptoms at this point, who someone they know or someone they've come in contact with has tested positive, who don't have symptoms? And what advice do you have for people who have symptoms?
Every day, we are inundated with calls from friends, families who ask the same question. And this is for all of those people who listen to it, like friends and families. The first thing is, I think if you have been with a primary contact and if you are suspected and you're getting some symptoms, or if the family member is getting some symptoms, I think the first thing is to accelerate your testing. Go quickly and get yourself tested, because if the thing worsens in 4 or 5 days, at that time you will not be able to go and get your test done, and the test will get delayed by 3 days. So step one is, the moment you have the slightest symptom, get either at least a rapid antigen test quickly or a PCR, whichever is easier available, but please do it. Both are available today. Government of India has made everything available. If you are having symptoms, there are a set of medications that you can take, whether it is Dolo, multivitamins, and a few other medications, which our guidelines are very nicely elaborated, which I can share with you. You can please use that, what the government of Karnataka's guidelines are, to show it to everybody. To say, look, start these medications and monitor yourself. Now, how do you monitor yourself? There are only two things. There is something called 6-minute walk test. Keep doing that. And that's something that somebody can easily Google up and check on what a 6-minute walk test is. Second thing is, in addition to that, monitor your pulse, through a pulse oximeter, monitor your oxygen saturation and keep monitoring it, and do not panic. Now, if you're breathless, that means if you are getting breathlessness, that is the time you need to immediately reach out for help. But otherwise, generally, fever is a common symptom and cough is a common symptom which comes and weans off in 3 to 5 days. There are a lot of online help available through telemedicine today, where doctors have set up a forum and are online monitoring patients. Please do enroll in those. Take help from hospitals. There are several hospitals that are offering this kind of help. Use their facility. Do not panic. But remember, if you need oxygen, reach out to hospitals or get home care to get oxygen concentrators to yourself. And remember, even in oxygen, most amount of patients will be doing very well with mild oxygen therapy, which oxygen concentrators can give, and do not need to panic to go to an ICU. It is only 5% of the people that may require an ICU. In such case, definitely that is the only answer is the hospital. I hope
So,
that that makes
first
it
of all,
clear.
don't panic. Reach out to your doctor, consult your doctor. And if you've come in, the most important thing that you said was, if you've come in contact with a primary contact, even if you have symptoms or not, get yourself tested, because that's the most important thing, and as soon as possible. The rest of what you said, including guidelines that Dr. Rao has shared with us, we're going to put it up in the description below. We'll also put out helpline numbers for Bangalore for people who want it in the description. But Dr. Rao, thank you so much for joining us and giving us all of this information, taking out that time for us. Thanks.